the St. Philip's College Physical Therapist Assistant Program. We are the first or oldest program in the state of Texas, and we are accredited by the Commission on Accreditation in Physical Therapy Education. Physical therapist assistants are the assistant to the physical therapist. So the physical therapist assistant will implement in the plans, the goals. This includes exercises. This includes all interventions that the physical therapist and the patient has decided to work on for their disability, their disease, their injury, or their recovery from surgery. Physical therapist assistants are very hands-on, and they are a crucial part to physical therapy. This is one of our labs. We have 2 labs that are designated to the Physical Therapist Assistant Program. And this lab, which is Center for Health Professions, room 314, as of right now, is set up like an outpatient facility. So an outpatient facility is where patients typically walk in and they walk out. This can be right after surgery, and right after surgery can mean 10 days, or it can be months after an injury that someone will come into the outpatient facility. So in this video, I'm just going to show you various things that we will do in an outpatient facility. We will perform some exercises on a total gym. We will also show you maybe some exercises that a patient will complete on the plinth. And then I'll also show you when we use ice modalities, ice pack, or either a cold pack. So one of our exercises and machines that we use in the outpatient clinic is called a total gym. It is a mat, in a sense, that's on wheels, so that patients that have knee injuries, even back injuries, ankle injuries, hip injuries, they can perform specific exercises. So I always demonstrate for my patients. So I tell my patients to safely sit down, and I will hold the mat if I need to. I will ask them to put their feet on the platform. The goal is 90 degrees. If I need to go a little higher, I will. And then what they're gonna do is flatten their back, tighten their core, they can put their hands behind their head, and they're just gonna push. We don't extend. We come to a stopping point there. And then I will have the patient do anywhere from 2 sets of 15 reps or 3 sets of 10 reps. And then we will progress. So we can progress to calf raises. We can use this as a stretch to stretch out the calves. We can also, as the patient progresses, complete one leg. We can also even add crossing the ankle or the knee to perform a stretch. If you're more advanced, you can jump, have your patients jump. So this total gym is a great tool for all types of injuries that involve the lower body, the hips, the knees, the ankles, and even the low back. Okay, so now we're on the plinth. Like I said, an outpatient facility provides so many options for the same injury. So what is a simple exercise that can be done is I have a weight on ankle, I'm working the knee, I'm working specifically the quadricep muscle, and I'm performing an exercise that requires me to fire these specific muscles. So again, I might ask my patient to complete 2 sets of 15 reps or 3 sets of 10 reps. You, as the physical therapist assistant and the physical therapist, will decide that special number on how many reps or sets. But this is just something very simple that can be completed throughout the rehab. You can have the weight heavier. You can take this out and have a straight leg. There's so many options for physical therapy and rehabilitation for the same joint. There are other interventions such as a hot pack and a cold pack that we will use for several injuries. So I'm going to show you a hot pack. So this is a hydroculator. Open the hydroculator, and I have several different packs. They're filled with silicone, but this is scalding hot water that we use. And what we do is we put the hot pack in covers to ensure that we do not burn our patients. But this hot pack is better than plugging in a device and putting it on our backs. This is just the best way to go for physical therapy. Okay, so this is our moist hot pack that we got out of the hydroculator over there. If you want to look at it, I have my really hot moist hot pack, silicone filled. I put a cover over it, and that adds layers. And then I have towels that adds additional layers so that the patient does not get burned. There is a certain amount of layers that must be applied depending on the size of the hot pack and the size of the body area that you are using the moist hot pack with. This is an actual table. Before I discuss plinths, plinths are more narrow and they're elevated. Some plinths do move, but the ones that we have do not. But this is an actual mat table or a table. This table will go up and down. There's a lever that is on one side of the table, and it will be used so that I, as the physical therapist assistant, or you as the physical therapist assistant, can have the patient where they need to be so that you do not injure yourself. So this is a recumbent stepper. A recumbent stepper is now preferred than a recumbent bike in the therapy setting. So this stepper provides an elliptical mindset to a bicycle. Now this right here is a rehab specific treadmill. So this rehab specific treadmill allows patients to walk backwards, and it actually declines if the patient needs to work on controlling forward movement as they walk. Also, with walking backwards, that is used to help with a lot of low back pain issues and injuries, and even with ankle injuries. For the physical therapist assistant program, we have 2 designated lab spaces. One is set up very much like an outpatient facility. The other one is set up more similar to an acute rehab or a rehab hospital or a rehab facility where there are nothing but mats. Very few plinths, just mats, because that setting requires people that are in wheelchairs, that have just come out of surgery. They require more space for their bodies to transfer to certain positions or to certain areas to help them prepare for the next stage of either going to a home or another facility. So this classroom or lab space is half lab space, half classroom. So second year students typically are in here. They learn the content out of maybe a PowerPoint or out of their book, and then they go straight to the mats and implement their knowledge or practice their knowledge. Okay, so our lab, this lab in specific, the classes that are taught in here are neuro, so neurological dysfunction, and rehab techniques. And they are both advanced courses that teach students how to deal with spinal cord injury, traumatic brain injury patients. This table right here is called a Barrehab table, and it is for the bariatric population. This table will hold up to 500 pounds. Most tables only hold up to about 250 to 300 pounds. So this table in specific is for the bariatric population, and it is called a Barrehab table. In physical therapy, especially in the setting where a patient has just had surgery or has had a stroke or traumatic brain injury, and we find out that they have stairs at home. Most patients will encounter even a curb or a step at some point, and stairs, these stairs that are a model of stairs, are used on how we teach patients how to properly go upstairs and how to properly and safely go downstairs. There is a little rule that we use as patients properly and safely go upstairs and go downstairs. So we use this accordingly for our patients. All right, so we have a Biodex balance system. The Biodex balance system is a platform that a patient will stand on, and you turn on the unit and it will elicit unbalanced or unstable surfaces, and the patient's goal is to maintain balance. There are games that can be played with this, but we are seeing this unit used more in our nursing homes and our skilled nursing facilities. Now this unit right here is a light gate. So a light gate are for those that are not able to walk, maybe due to spinal cord injury, traumatic brain injury, car accident, from broken bones, and they are healing. So you will strap the patient in this harness, and then you turn on the treadmill, and the patient, you will elicit walking, which is something that our brain automatically has done since we were 1 year old. Well, I hope you enjoyed our tour of the Physical Therapist Assistant Program, our 2 designated spaces, and some of the remarkable equipment that we have. We hope that you are interested in our program. We hope that if you have any questions, please do not hesitate to reach out to us and enjoy our field.